Welcome back. It's 9:13. Now on Good Day Orlando, it has been 6 months now since the coronavirus pandemic began, turning everybody's lives upside down. Now, in the beginning, there were a lot of unknowns with coronavirus, but we have all learned an awful lot since then. Joining us now with a closer look at the biggest discoveries is Dr. Jason Littleton. It is always good to see you, Doctor. Good morning.
Good morning. Hi, Danielle.
Okay, here's what I would always do. Right at the beginning of this, I'd order my groceries. They'd be on the porch. I'd spray them down with Lysol, wipe them down, bring them in, then spray down the cans, and then put them in the cabinet. Are surfaces something that we should be worried about?
No, not as much. We should focus more so on airborne transmission. I think in the beginning, we were worried about washing down fruit, washing down grocery bags, washing down every surface. And I'm not saying you shouldn't keep a tidy home and sanitize surfaces, but the main way is breathing the virus in through our nose and mouth. And we have to protect ourselves by wearing masks. So that's one of the things, that's one of the misconceptions that we learned as time went on, that wearing masks was the most important thing.
Well, let's talk a little bit more about masks, because I was watching something, I don't remember what it was, it said that right now masks, that is the vaccine, because that is our best hope against stopping the transmission of this virus.
Right. So, we've learned that by wearing a mask, we can reduce the risk of airborne transmission going in through our nose and mouth. And there are several different types of masks. We've learned that those with a thicker consistency or a 2-ply consistency are better. N95 masks, surgical masks are the better options. Those masks with the one-way valve, that's not a good option, because we can basically expire our air through those valves and people can receive the virus that way.
Also the neck gaiters too. I see an awful lot of people wearing those.
Yeah, and those aren't as thick as a lot of the masks that you can find, like with the surgical grade consistency. So, again, yeah, it covers your face. It can reduce the risk, but again, they're not the best option. So,
Dr. Littleton, what would you say is the biggest thing that we've learned about the spread of COVID-19 in the past 6 months? Is it the airborne transmission?
Absolutely. I think that in the beginning, we were talking about the virus being on surfaces from 2 to 9 days. People were very concerned about public transportation. They were concerned about going into all sorts of areas like public restrooms, worried about sanitizations. Of course, flying was one of them. And I'm not saying those aren't concerns, but I think the biggest thing that we've learned is that healthy people don't get the virus. And I think the best thing that we can do is stay healthy, improve our overall health. Now, again, when the CDC came out with that report last month, about 96% of people had 2 or more comorbidities, I think that taught everyone that the best thing we can do is invest in our health. If we do that, we can be better prepared to fight the virus. Let's
talk a little bit about glasses, because we know that wearing masks stops the transmission if it is, or helps stop the transmission if it's airborne. But if you're not wearing glasses, can it get into your eyes?
Absolutely, it can. Again, you need a high viral load to be able to cause infection when it gets in that way, but that's something that we have to protect. As a physician, I'm wearing goggles in the hospital, and when I'm working with patients, I'm wearing safety glasses. And people, who are at a higher risk for developing, infection with COVID-19 should wear some type of eye protection. I think it's very important. It's a mucous membrane, and it's susceptible to having virus contact.
And I'm sure 6 months from now, we'll know even more than we do today. Dr. Jason Littleton, thanks so much for joining us. We always appreciate you.
Thank you. Thank you. Appreciate you guys.
9:17, Jamie.